I talk a lot about micro skills, those small intentional actions that create big impact. That's the focus of Micro Skills, Small Actions, Big Impact, a business and leadership book about transforming your work and relationships through simple, deliberate practices that anyone can champion. Whether you're leading a team, building your career, or navigating everyday challenges, Micro Skills help you show up with more intention and effectiveness. This holiday season, Micro Skills is available at all major booksellers, including Bookshop and Amazon. You can get it in hardcover, ebook, or audio. Small actions, big impact. This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. Audience, today I am thrilled to welcome Dr. Shan Liu, an emergency medicine physician, Harvard Medical School faculty member, children's book author, and the great-granddaughter of a true medical pioneer. We're diving into her brilliant children's book, Masked Hero, How Lian invented the mask that ended an epidemic. So it's a true story that connects a century-old plague outbreak, that's the pneumonic plague in Manchuria, China, and reminds us that innovation often comes from the margins. Shan, welcome to the Visible Voices podcast.
Thank you so much, Dr. Lewis. It's such an honor. You've been such a hero of mine ever since residency, since I was an intern, and you took me under your wing and shared inner secrets of how to get things done as a resident. So I'm so excited for you and for your incredible book that has really shared with the whole world all the secrets, I think, of how to be successful in our careers and in our lives. So thank you for the opportunity.
Well, thank you for the thank you, and it's a joy opportunity to be in conversation with you today. So, Shan, in addition to an MD, you have an MPH, and also you did some work at the London School of Hygiene and Tropical Medicine. I wonder if you can tell us a little bit about those stages of training.
It all sorts of starts back in high school, where I did a immunization campaign with the group Amigos de las Americas, which allows teenagers to go abroad and do public health programs in Latin America. And I just fell in love. I thought, this is what I want to do. I want to help others. I want to be helping vulnerable populations and be able to have an impact. And so that was something I started in high school, did work in college, and then ultimately after med school said, well, there's this London School of Tropical Medicine, and you can do a 3-month course in tropical medicine as a specialty. And it was amazing. So this was several years after residency, and after I was in the middle of my doctorate work at the Harvard School of Public Health, and had finished my qualifying exams and had 3 months that I was allowed to go abroad, and basically, spent 3 months with, I think, 50 or so other people from all over the world, from Asia, Africa, from London, from Europe. And I still have friends from that program to this day. And many of them do clinical work abroad. Many work for Doctors Without Borders or are missionary doctors in Sudan. So incredible work. I have since pivoted sort of to do more work with the vulnerable population in the emergency department, but hope to go back to that. I think there's this reality of you can do global work, but it is more challenging when you have children and you have a spouse that can't necessarily work abroad in a village. But I do hope to go back to it someday.
What I'll say is, they say local is global, global is local. A lot of the work that we do in global health ends up actually being the exact work we're doing here at our hospitals and our hospital systems in the United States. I love this thread geographically of you doing work and study in the UK. So let's go right to your children's book. The COVID pandemic really inspired this project. There are many things I love about this book. You wrote it with your daughter. And I love this that you were recently giving a talk about this book and your experience through COVID and the inspiration for the story. And you shared that you and your then first grader were being interviewed about the book, and they asked her what it was like to be a published author. And she said, well, I've always wanted to be an author. And meanwhile, you were like, what, since kindergarten? Like, it's so funny. Like, kids are just so funny. Your great grandfather is the focus of the content of the book, but there's more to it. I'm wondering for audience members that haven't read the book and purchased the book for the holidays yet, what will they read and what will young readers learn in this book?
So the book is about my great grandfather, as you mentioned, and how his story of his life and how it led to him creating the first respiratory mask. So it starts off as he's a child of 10 in Malaysia, and always wants to study medicine. Studies super hard, ends up going to England, and is actually the first Chinese Malaysian, or ethnically Chinese or ethnically Malaysian, to study medicine in the UK, or at the University of Cambridge, I should say, and ends up fighting a lot of racism there, because he's like one of the first. Ends up studying many years there, in London, in Liverpool, in France as well, and then ultimately goes back to Malaysia, where again, even though he's trained and has a medical degree from the UK, or from England at the time, he's not allowed to actually get certain jobs in Malaysia, which was a British colony then, because he wasn't European. So he ends up leaving Malaysia a couple of years later, and going to China, and ultimately is recruited up to the north, where in Harbin, in Manchuria at the time, they have this outbreak of this deadly plague. So 99% of the people are dying. Nobody knows why. He, with his training, does the first autopsy in China, on this person, and figures out that the plague is not being transmitted through rats, but really is being transmitted through respiratory droplets, and ultimately designs a mask that becomes the predecessor of the today's N95 mask. And there's a story of how the French doctor who's there at the time also says, you Chinamen, why? Basically, again, he's encountering racism, because why would a Asian be able to have an idea about the spread of bacteria? He goes on to implement things like quarantining people, isolating people. He shuts down cities, and this ultimately stops the plague in 4 months. So 60,000 people die, but in 4 months, he ends this whole outbreak. And he ends up going on to becoming the quote unquote sort of the father of more, I'd say, for lack of a better word, Western medicine, but he does sort of marry traditional medicine with sort of quote unquote Western medicine in China, and becomes sort of the father of public health there, and ultimately becomes the first Chinese to be nominated for a Nobel Prize in medicine. And so, fast forward, 100 years later, COVID emerges, and every day I'm going into the hospital wearing uh, the device that my great grandfather invented 100 years beforehand. Although now it's called the N95 mask, but he basically created the first respiratory mask that ultimately ends up becoming today's N95 mask. So
And I want to interrupt you right there. Like, this is sort of here are the threads. Now the audience understands, like, you're doing work in the UK, his doing his medical studies in the UK. The masks that we wore during COVID, the N95, traced all the way back to this healthcare design innovation that your great grandfather came up with way back in the early 1900s. Did you ever see this coming? Like, were you like, oh my gosh, this is full circle and I'm sort of manifesting the legacy of my great grandfather?
my great grandfather's autobiography was always on our living room table, and we always talked about my great grandfather's work, and that he named my great grandfather as being the Surgeon General of China, or for lack of a better description of him. So I'm sure that played a role in me wanting to do medicine and doing public health. It just seemed like a very natural thing for me to want to do. My parents didn't necessarily pressure me, but I was always just fascinated by public health and work. And maybe it's just from stories from my grandmother and from my father, and just hearing about the impact that he made. So I didn't exactly expect that we'd have a global pandemic, but as there was more and more work going on about how we could stop the pandemic or stop the spread of COVID through the mask. There were more stories that were coming out about, who invented the first mask. And so his work started to be publicized and written about, largely because he organized international conferences after the plague to say, this is what we need to do. These are best practices. And what's ironic, I think, was at the time I was so upset because we were not doing that as in the world. We were not necessarily sharing practices. And I felt like there was a lot of just resistance to saying, "Oh, we're going to learn from Asia, who's been managing this for 4 months, and we're just going to do it the way we think is important." And in fact, I asked people in the hospital, like, I think we should be wearing masks, and they said, "Well, there's no good data for masks," and I just laughed because it was like, and was frustrated, like, we need to protect ourselves. We're not have
Do you
time for a
know who
randomized
I
trial.
am? Do you know
Exactly.
who I am?
I was like, I am not going to be, if we're going to do a randomized trial, I am not going to be in the control arm.
Continue your story.
So I I think as emergency medicine physicians, we were on the front lines, obviously seeing what was happening. And from the public health standpoint, I said, no, this is what we need to do. We need to socially distance. And I was upset because as a person on the front lines, as an emergency medicine doctor, I thought we could really get ahead of this. So I ended up writing some articles for CNN and for US News and World Report, just saying this is what's happening in Boston. This is what's happening in Boston. This is what's happening as emergency physicians. We have to step up and do the right thing. Social distance, wear masks. But it was also I was upset because I thought we really can learn from other countries. We can learn from why do we have to reinvent things ourselves? Because that's going to delay time. There's going to be a delay in time in terms of trying to get ahead of this. So I wrote those things sort of out of frustration, and then of course dealing with watching all of the racism that was happening against Asians, and of course this became a bigger issue. But particularly at that time around April, May, there were certainly things that were happening in the Asian community, and at the same time, my daughter, as we were homeschooling her and not doing a very good job, I signed her up for this class. She ends up having to do this online nonfiction piece, and I said, you should learn about your great great grandfather
Yeah.
because we were having all these debates about should we wear masks, should we not, and so we picked up one of these. We started learning about him. I had her just write about him because everything was closed. The only thing we really could do with our children was read books to them, and we noticed that there was a real lack of books about East Asian heroes, and so I just kind of dealing with all the stress of COVID and dealing with the anti-Asian sentiment at the time. I looked at my daughter and said, "You know what? We're going to do this. We're going to write about this because I think people should know why they wear a mask and who invented it." And the real motivation was trying to fight, racism, and also trying to talk about a public health story, and also trying to give hope that if we wore masks, we could end this pandemic. So those are the motivating factors, and really, this was really just my way of dealing with the entire stress of COVID. And
Yeah.
so it was real this passion project, and I just there's a couple times in my life where I felt like this is my calling, and I think this was one of those. It was like we're just gonna have to do this.
We as physicians, emergency physicians, we're particularly good at sublimation and channeling energy, and like these negative feelings into something very productive and very good for society, right? And so here we are with this beautiful, beautiful book. Um, you've shared the funny story also when you've spoken about the book that you were advised that you should make it whimsical. And you're like, first of all, am I whimsical? And second of all, is this topic really whimsical? But you really just pulled it off well. And I'm interested if you can
Thank you.
tell the audience and me a little bit about the illustrator, Lisa Wee, because it seemed like it was intentional having her come on as your illustrator partner.
Oh, that's a great question. So I shout out to my daughter's kindergarten teacher who did a lot of, she's published a lot. She told me, I basically emailed her and said, I need to tell the story. I don't know where to start. Please tell me. I am a doctor. I have no idea how to start writing a book or how to get connected with an agent. And she basically said, oh, you can go through a group called Reedsy, which is also ironically in the UK, but it's sort of like the Craigslist of the publishing world. And you can actually just put your pitch out there and you can say, this is what I want to write about. And ironically, or should I say, um, maybe it was fate. Lisa Wee said, oh, I love this story. I'm Malaysia, or I'm in Singapore. And she basically, I loved her work and she was really interested in the story because of her heritage. And so it was just sort of like perfect, the stars were aligning. So I've yet to meet her, which is ironic. We've done interviews together, but I haven't yet to go and meet her in person. But she's done a phenomenal job, and her career has really taken off.
Yeah. This strikes me as a great time to ask you about your voice. Sean, when do you think you realized you had a voice and when did you start using that voice?
Oh, I love that question. So I think Asians in general were taught to be quiet and sort of. mm, My dad has always said, you don't need to bring attention to yourself. Your work should speak for itself. So that sort of is how I was always raised. And it doesn't always align with getting farther in a typical Western society or department or world. So I think I always struggled that. I always got feedback like, "Oh, you should just talk more in conference, or you should just promote yourself." And I said, "It's just so hard for me. It still is difficult." But doing this story or doing this book really, I feel like it's not necessarily my story. It's talking about my great grandfather, and it's talking about my daughter. But I also just felt like as I mentioned before, there's just 2 or 3 times in my life where I was like, "This is my calling. I just have to do it." And learning how to use that voice, because it's for a greater good. It was for all of the things I mentioned before, trying to give really really as a mom to try to make sure my children were not ashamed of their heritage and who they were, and had really this motivation to do that for other children and to say, I can't change racism, perhaps by the time people are adults, but maybe I can tell the story and kids can say, oh, okay. I can see Asian heroes, or I can see East Asian heroes, I should say. Um, so that is sort of how I got my voice, and it's been really exciting. It's been such a wild ride. All of these things sort of happen organically. Like people just say, "Oh, I heard about this," and people will email me, and so finding my voice, and being visible, like the invisible voice, like your podcast title. Um, I realize I'm just part of this movement to try to change the thought process of who is thought of as a hero.
Yeah.
In the same way, I think my relatives have said, we know who invented penicillin and we know who invented the light bulb. Why should we not know this story?
This is a perfect moment for me to inject, yes, medical joke there. Um, Healthcare design and how innovation comes from need, necessity, but also simplicity. I have here that the actual design was great, handmade, cotton and gauze, completely cover the face with the eyes visible, and it really, and, tie it tight at the back of your head, and it wouldn't blow off with the heavy winds, and it just worked to keep out those respiratory particles. So, hat tip to great grandfather.
Yes. Exactly what you said, which was out of necessity, we have innovation. And we
Yeah.
saw that in COVID too, right? I saw you would see people have things for their mask so that they wouldn't have irritation to their ears, and we would have a ton of people trying to figure out how to have intubation boxes where we wouldn't be as exposed. I mean, people people out of need do have
Yeah.
to, especially when the mortality rate was so high. It was like either this or, one perishes. And
One of my favorite questions to ask authors is the question I'm about to ask you. How are you different having written this book?
that's a great question. I think I feel like, as you know in your book, your job doesn't always love you back, that you have to take control of um, also pursuing your passion projects. And I think being an author, I realize how much work it is because once we finished writing it, it was like the work started to begin, which is promoting, getting the story out there, marketing, all things that are um, not necessarily what you're taught as far as when you start this journey. Um, and so I think what I've learned is, but also this whole project really was uh, rewarding because I was doing this not necessarily for academic credit, and I wasn't doing this because it was gonna like help me with my RVUs in the emergency department. I was doing this because I really felt passionate about it. And there's something about that when you get to the point in your career and you're like, I'm gonna just do this because it's the right thing to do. And it's not for financial reasons, it's not for, necessarily glory. It's really because I want to tell this story. And I think it really helped me say, I love telling stories, and whether or not it's up through a book or doing these story slams, which I've been invited to give a couple times, in terms of sort of like moth talks and things like that. And I've really enjoyed it. It's somewhat terrifying, but so rewarding and just a lot of fun and learning skills that I've haven't had a chance to learn before. And so that's been exciting, I think, as a mid-career person to just to learn more. And a lot of it is putting yourself out there and being vulnerable. And I think, as you say in micro skills, that being okay with being vulnerable helps you connect with people, which does have dividends. And learning that, I think, going from like being a younger, junior faculty to being a mid-career person and saying, you should actually embrace those times when you are learning, even though they're hard.
So, Dr. Shan Liu, thank you so much for sharing your time, your space, your voice on the Visible Voices podcast. For audience members that want to keep in touch or keep up on your work, what's the best way?
We have a website, which is shanwoo ShanWooliu.com. It's the best way. There's a form. You can keep in touch with me and follow us.
This holiday season, give a book that inspires. Masked Hero tells the remarkable story of Dr. Lian, who invented the first N95 mask during a deadly 1910 pneumonic epidemic outbreak. Written by his great-granddaughter, Dr. Shan Liu, and her daughter, this award-winning children's book shows young readers where real innovation comes from. Perfect for curious kids and anyone who loves stories of unsung heroes. Available now from all major booksellers. The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis MD on social media or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by our hosts and guests are their own and do not reflect the opinions of their institutions. Information shared here should never substitute for clinical judgment or for medical advice. Together, we're making healthcare more equitable, one visible voice at a time.